Good morning, good afternoon, good evening, everyone. The time is ticking, and this is like about the final of the session for the World Hepatitis Summit. So we have the Hep Can't Wait, and then the closing remarks. And I'm deeply honored to have Dr. Meg Doherty as the co-chair for this. And the next few minutes, we're going to look at a session that reflects on the human impact of hepatitis, why indeed hepatitis matters, and why hepatitis can't wait. So I'll hand over the microphone to Meg, of course. She's going to also facilitate part of this session. Dr. Meg.
Thank you, John Juma. I think all I can say is this has been a wonderful 5 days for us because we started a day before, and I think you had some weekend work as well. And I don't think anybody needs to wait for me. I think it's better if we go and we hear from the patient's perspective as well as reflections from community. So I'll pass back to you, Danjuma, and I'll make comments later.
All right, thanks, Meg. So we have three great people to share their stories, to reflect on people living with viral hepatitis and the wider communities, and of course about all the issues we've had discussions around this about hepatitis. So we have Oan Card from Center for Supporting Community Development Initiatives, Vietnam. We have David Urick. So they're going to tell us a brief about themselves and then to go on to share their stories. So David, I'll start with you.
Thank you, Danjuma. It's been a very interesting week for me as a patient advocate. I've spoken multiple times before, just telling my story of living with hepatitis B my entire life and some of the struggles and challenges I faced doing that. You know, in between the two times I've spoken here, I've just been listening to a lot of folks, and sort of what I can see is that there's a lot of mirrors in the struggles that patients face ourselves, and then some of the struggles that you all face as your organization's fighting for people like me. And it's kind of like a slight anger I felt this week, learning about how hard we all have to fight for our voices to even be heard by some people. But it's more of a focused anger where I just don't want this to happen to anyone, and it's kind of empowered me to rethink about how I approach advocacy and what my voice as a patient can do besides just telling my story. And speaking from a patient advocate perspective, I think there is just so much more potential for people like me to figure out how to find their voice. My life has been, filled with wonderful opportunities that have been presented to me because of the privilege of my circumstances of birth and my healthcare team. And I think if we have more equity in the way that other patients and other people that don't even know they have this yet, what they can do for themselves when they are told, diagnosed with this, I think there's a lot of potential for a pathway for advocates to sort of just see that there's a bridge there. Sometimes it can feel like, for half of my life, I felt as I was fighting this battle by myself. And, it's just needs to be reiterated that no one is alone in this fight, but some people do feel alone. So we need to really bridge that gap and figure out how to let these people know that they're not the only ones that are fighting for themselves.
So David, if I may ask you, if you're asked to give two key messages, one to the community, two to either funders or global partners, what are those two key messages going forward as the key lessons and the key takeaways we've had from this summit? Right from Monday, we had a pre-summit, to today that we're closing.
In regards to the community aspect, what I would say is there's always time to find your voice. Sometimes I felt as a speaker that that my voice can only do so much, and that sometimes there are some mechanisms in play that we can't see as patients or advocates. And I think that what I just want to put out there to other people that could potentially be in my situation is that once you start the path to patient advocacy and being really, really connected with the illness that you live with, I think that the benefits of that are just something that can't be measured. I think my entire life has been changed in the last 3 years, and really those were a few key moments, and that was just seeing other patients speak about their truths. And what I would just keep saying is just, when you find your voice and you have an opportunity, use it. And as far as the funders go and the people that can make the gears turn in this world, you just need to listen more. You need to understand that this is a real thing for everyone on both sides, patients and the people fighting for them. And it just saddens me how loud we have to be sometimes. But what I am hopeful for is that with continued efforts and continued collaboration, that the funders and the way that we are evolving as a Hep B community can keep changing for the better. And I think that the summit has just taught me that optimism is a key takeaway from this for me.
Thank you, thank you. And on that note, I'd like to introduce Juan Quat, who is from the Center for Supporting Community Development Initiatives in Vietnam. And you're really our advocate, we know, for so many things. And you bridge between UHC, HIV, hepatitis, and those who are most vulnerable, those often forgotten key populations. And so perhaps you can reflect on what your key takeaways, 1 or 2 key takeaways, and what this meeting meant to you.
Thank you, Meg, and good afternoon, everyone from Geneva. I have to say that I'm so glad that I have the opportunity to attend this summit. So thank you, Carrie, for inviting me. Some people ask me, because I spent 1 week in Berlin and before coming here, so another week here. So it's a lot of time away from family and work. But I'm so glad I'm here. It is a week full of learning and full of inspiration. And it's full of guilt as well, I have to admit. Being here, I felt like I haven't done my part. So the part that I could have done for hepatitis, I could have done more for hepatitis B. I could have done more for the mother who have hepatitis B and C, may transmit it to their children. So I felt that I have been quite ignorant. I work on hepatitis, but I haven't done enough. I could have done more. So just to say that thank you for giving me this opportunity to learn, but also to reflect on myself. And I think I can do more, a little more. Of course, I cannot do a lot, but a little would count, right? If everybody do a little, we can make a lot happen. Thank you.
Thank you. And it's clear you're passionate about this topic, and certainly I think that's one thing that many of us have learned. We spent a lot of time on Hep C, but the inequities in Hep B, the inability to get the treatments for Hep B at a reasonable price, I think we all learned a lot to hear. So we can do more, I know, and we can't wait. So now I'm going to pass back to Jen Duma.
Oh, thank you. So we have online Dr. Patricia Vele. She is the executive board member, one of the World Hepatitis Alliance board members. She's also going to share her experience. She's from the Guatemalan Association of the Liver and the PAHO board member. Dr. Patricia, you've heard the other speakers, and you've been part of this meeting. So as a patient from the community and also as a scientist, what would you say are key learnings you've had from this meeting? Dr. Patricia. Could you unmute yourself? We can't hear you.
Thank you. Thank you. Good afternoon, everybody. Thank you, Danjuma. And from this meeting, I have learned that we are making many achievements. So one of the important things is that voice of the patient can be heard, because doctors don't know how to treat the disease, but the disease is not only a disease, it's a human problem, because people with hepatitis can suffer because they are fatigued. They have a disease that is not only a liver disease, it's a disease that affects all the body, all other systems of the body. So if we have cure for hepatitis, if we have many ways for diagnose hepatitis, if we have how to control hepatitis B, we need that the doctors, that the people get tested and get treatment. Because if you have treatment early during the disease, you will not have cirrhosis, you will not have liver cancer, because cirrhosis is very expensive disease to treat, to maintain. And liver cancer is a disease that needs a transplant, and in many countries, transplant is very expensive. In my country, Guatemala, we don't have transplant. And maybe we have to sell houses, or people has no money for transplant. So please, I think we need to awareness people about the diagnosis is, and the cure for hepatitis C, and the control treatment for hepatitis B. Please, we need to work together. We need to work together with the patients, together with the doctors, together with the governments. And I have many friends that had died from cirrhosis, from liver cancer. And now there are teenagers with cirrhosis in my country, and they don't have money for the treatment of cirrhosis. They don't have money for transplant. So please, I am asked for you, I urge that make test accessible, make treatment accessible for people. That's what I have to say.
Thank you very much. It's a real call that we have to bring equity around the world, and that it can hit anybody, children, adolescents, adults, and that testing certainly and awareness has to go up enormously, as well as access to treatment that's reasonably priced and accessible. So thank you very much for those comments. I think everybody has very strong feelings that we have to do more. It's now my pleasure to invite Danjuma Ada to the podium, where he'll be reading the World Hepatitis Summit 2022 statement. And I would ask others, Carrie James and Dr. Rui Tato Marino, to join us here on the stage. Thank you. Please.
At the 2022 World Health Assembly, countries recommitted to eliminate viral hepatitis by 2030. Since the initial historic commitment in 2016, the Sustainable Development Goals 2020 target of reducing the prevalence of hepatitis B in children under 5 years to under 1% has been met globally and in most WHO regions. In addition, the number of people receiving treatment for hepatitis C has increased tenfold to more than 10 million. However, globally, more than 350 million people are still living with this life-threatening disease. The gains made have been uneven across the world, with those most impacted often least likely to benefit, and most countries have failed to meet the GHSS 2020 targets. Few babies have access to the hepatitis B birth dose vaccine in many low and middle income countries, with less than 10% in Africa receiving a timely vaccine. Additionally, infection and prevention control in healthcare settings needs further improvements, and harm reduction remains insufficiently scaled up and accessible. Stigma and discrimination continue to be a barrier to testing and care. Only 10% and 21% of people know that they live with chronic hepatitis B or hepatitis C respectively. Even fewer have received treatment, and liver cancer related to hepatitis is on an exponential rise, especially in low and middle income countries. Furthermore, acute hepatitis A and E continue to impact people's health all over the world. The participants of the Third World Hepatitis Summit believe that the new global health sector strategies on HIV, viral hepatitis, and sexually transmitted infections 2022 to 2030 provides an opportunity to refocus global efforts, accelerate the response, and recommit to the elimination of viral hepatitis by 2030. To make the elimination of hepatitis a reality within evolving health systems, we call on countries, global partners, and other stakeholders to act now to achieve the 2025 and 2030 targets by developing and implementing national hepatitis strategies which address the 5 strategic directions of the GHSS and put people living with viral hepatitis at the heart of the response. We ask that multi-sectoral action, which recognizes civil society as an integral partner, is taken to operationalize hepatitis programs which promote integration, decentralization, and task shifting to improve access. We call on governments, global health agencies, and donors to honor commitments already made and further commit to prioritize and fund comprehensive hepatitis program so that everyone, everywhere has access to affordable prevention, testing, treatment, and care. We also call on the 350 million people living with viral hepatitis and their communities to unite, amplify their voices, and take their place in the hepatitis response. Hepatitis can't wait.
Thank you very, very much. At this point, I'd like to call on Carrie James from the World Hepatitis Alliance.
Thanks, Meg. And thanks, everybody. I mean, wow, what a final panel. You guys are incredible. Thank you so much for everything that you've done at the conference and you continue to do just out in the world. It's been a great meeting. I think for me, it's been incredible to see the hepatitis community come together, but to watch other players in the global health community, like in cancer and maternal and child health, UNICEF, UNDP, all of these people come together and really kind of with such positive messages about how we can work together to really, have this whole system response to hepatitis elimination. And that was really what we were trying to achieve with this conference. And I really hope we did. So as we close 2022, we look to 2024, and I think the slide has stolen my thunder slightly, but I'm really proud to announce that the World Hepatitis Summit in 2024 will be in Lisbon, Portugal. I mean, we're super excited. I mean, not only is Portugal a great place to go for a conference because it's a beautiful city with amazing food, but of course they have, amazing community organizations, amazing track record in serving the needs of people who use drugs around hepatitis C. So it's going to be an absolute great pleasure to be there. And I think we'll not only be able to learn from each other, but also from the great work being done in Portugal. And just to talk about that a bit more, I'm very proud to have Professor Rui Tato Marinho, who is the director of the National Priority Program for Viral Hepatitis at the Portuguese Ministry of Health, to say a few words. So Rui, please.
So hello everybody. Thank you for the invitation, for choosing Portugal. I'm a medical doctor. I'm a gastroenterologist and a hepatologist. I work in the Hospital Santa Maria, which is the biggest hospital in Portugal, and I see liver patient, liver issue as a physical, mental, social, and also spiritual issue. I'm the director of the new program for viral hepatitis, which is a priority program, and I work in close collaboration with the civil society, which the most important is Luís Mendonça. It's worldwide known. Portugal is a peaceful country, not in war. It's a population about 10 million. It's 2 times the area of Switzerland. It's between Spain and the ocean. We are protected by the ocean. It's a democratic, completely republic, and we are in the European Union, here close to Spain. We, as said, not now, but anyway, one of the best health systems in the world, public health system, classified by the WHO as the 12th in the year 2000. Very long expectancy of life. Huge problem, a catastrophe has appeared after the revolution with IV drug consumption. 1% of population, especially young people, has consumed IV drugs in the past, not now. And we think we still have 30,000 people to treat. I think, in my point of view, as a medical doctor, and with my experience, that hepatitis are not only letters, is a complex situation. Cirrhosis, it can lead to cirrhosis, to cancer. The two viruses are oncogenic virus. Is a cause of death, palliative, cause of suffering. So it's a very, very complex disease. We have some very good things in Portugal anyway. I will call the 5 stars achievements regarding liver disease, from hepatitis B vaccine for all newborns in the last 20 years, C treatment free for all, B treatment free for all, a very, very good liver transplant. We can save a lot of lives by the liver transplant. We have microdomination projects to go to prisons, drug decriminalization, etc., etc., and free health for all, which shows a very good assessment. Our government is very happy with this World Hepatitis Summit going to Portugal. The person in the government in charge will be the Secretary of State. He's a medical doctor, so he understands very well our language, our situation. They've made, the government made a letter supporting this meeting, important meeting in Portugal. saying that hepatitis can't wait. Of course, they are getting our message. Portugal has very good things. Cristiano Ronaldo, almost with 40 years old, still competing. The national music, the fado, is very sad, of course. Very good pasties, Oporto wine, red wine, and Antonio Guterres saying in 2027 about peace, a year of peace, not anymore, of course. Portugal has very good, nice landscapes by the sea, old castles, modern things, good food. A very nice minister of health, Marta Temido. So I hope to see you 2024 in Lisbon, Portugal, for very good and nice days. Thank you very much for choosing Portugal again.
Thank you, Professor Rio. We just hope Ronaldo will be there when we have the summit. Maybe we kick some balls and then you make him one of the hepatitis ambassadors. That would be awesome, isn't it? Okay, distinguished colleagues, guests, and friends, before we go to the final two closing remarks from the World Hepatitis Alliance and the World Health Organization, please, I would like to call the staff. You need to see the people that have been behind putting this together, the World Hepatitis Alliance team. So we have some small packs to give them. Jessica, head of program, Cynthia, Laura, all the great World Hepatitis team. Please, where is Katka? You see her all around. Wonderful, wonderful people. Let's appreciate them more. Yeah, thank you. We're deeply honored to have you guys as wonderful WHO team. Thank you. And this will not be complete if we don't recognize one other person, our wonderful Lydia. Where is she? Please come over, Lydia. Yes. Let's recognize our All right, thank you so much. And before I read my final remarks, I want to say that WHO team, congratulations, and WHO also. It's been great all these days. Thank you so much. So this is the closing remarks from the World Hepatitis Alliance. And then after that, I'll call on Dr. Meg to give the closing remarks. But before then, I want to recognize Dr. Su Wang, the chairperson, the chair of the program organizing committee. She's joining us live. Could you please put your hands together and appreciate her? And then Dr. Su, do you have one or two words to say before we go to the closing remarks? Su Wang, please.
Thank you, everyone. I'm sorry I can't be there in person, but it's been phenomenal seeing this whole thing come together. It's been so much planning. I mean, we've been planning this for years. There was a break since our last summit, and so we've been talking about the summit, and we were disappointed we couldn't meet in Thailand, but then when we pivoted and there was an opportunity to be in Geneva live, I think this has turned out to be really a great opportunity. We've been able to connect with a lot of other colleagues who potentially may not have made it, but we're in Geneva, so we were able to have other organizations here live. So I think it's been amazing. And yes, it's been definitely a labor of love, I think, for so many people. And so I just want to appreciate everybody who's been in on so many meetings with us. And I was just laughing because My phone has taken the brunt of it. As I was texting, I can't text negative. I was trying to say something like a negative test result. It always goes to Meg, M-E-G. Like instead of saying negative, it says Meg now, my phone. So it's been just at the forefront of all the so much of the efforts of everybody here. So I just want to thank everybody for being here. All the people who spoke as we were going through the sessions. I think those of us who are on the program committee have a very difficult time knowing which session to go to because they're like our children. It's hard to find your favorite child because you've had a role in selecting the speakers and the abstracts and the co-chairs. And they were all really, really excellent. And I look forward to being able to listen to the recordings, and they'll be on the platform for 3 months. So I really urge everybody to take the time to go back and listen to all the sessions that you were not able to make, because there's obviously so much wealth of experience and much to be learned from those. And I'll close with that and hand it back to you, Danjuma. Thanks.
Oh, thank you so much, Sue. We are indeed privileged to have had you as the chairperson of this program, and thank you so much for all that you've done, for sacrifice and all the commitment to ensure that this program is a success. And I'm also deeply honored to give these closing remarks on behalf of the World Hepatitis Alliance. So thank you everyone for participating in the third World Hepatitis Summit 2022 and for renewing our commitment towards viral hepatitis elimination. We want to thank most sincerely the Director General of the WHO, Dr. Tedros, who personally attended the opening ceremony, and the entire WHO team at the global and regional offices for providing the leadership over the years in driving efforts towards viral hepatitis elimination, which culminated in the renewal of the GHSS 2022 to 2030, and for hosting us for this third edition of the summit. Over the past 4 to 5 days, we have facilitated conversations, established new partnerships, networking, and friendships during the summit. We have listened to pledges, promises from partners, challenges, best practices, aspirations from diverse stakeholders, including researchers, policymakers, clinicians, patient advocates, and all that matter in this struggle. We indeed left no one behind. Each of us faced unique challenges, and many of these specific challenges are different. But one thing we all demonstrated is a collective will and passion to eliminate viral hepatitis as a disease of global public health importance around the world. And the final message I want to impart as we close out the third World Hepatitis Summit is that we know how hard the work is going to be ahead of us. It's going to be difficult, but not impossible, to achieve the elimination goals and targets of viral hepatitis with the available tools, vaccines, treatment, and cure that are available. We have all demonstrated that we care enough, and that is why we remain engaged throughout the summit, and we hope that political leaders, development partners, corporate organizations out there care enough to invest financial resources into viral hepatitis elimination. We hope that these past 3 to 4 or 5 days of the summit have stirred the passion, renewed our commitment, and ignited a flame in our hearts to care enough and to see the urgency of viral hepatitis elimination, because hepatitis can't wait. We wish us all safe travels and best wishes in the days and years ahead till we meet again. Thank you and stay safe. So I'll call on Dr. Meg for the closing remarks from the WHO. Thank you.
Thank you very much. And I think Danjuma is the politician among us because he has a silver tongue. Every time I listen to him, I'm very impressed. And apologies, I'm still just a doc, you know. But in many ways, I want to thank all the participants. I want to thank Carrie, Danjuma, Sue, the entire team that has been working with us tirelessly from the World Hepatitis Alliance to make this a reality, and all of you who joined, as well as recognize that our WHO Global Hepatitis team, which is small but mighty across the 3 levels, have really put in a huge amount of effort. And And we'll add in Laurent Poulin as well, who's been here helping us do everything behind the scenes and making sure things are working. It's been a fantastic week. And like I said before, I feel like I'm constantly learning with you because I haven't been at the previous two summits. And so I think what we've proven is that we can master the hybrid. This was fantastic that we had excellent in-person conversations, excellent interaction on the computer, and only with a few glitches did we end up with any kind of challenges. So maybe this, this is the wave of the future, that we have a few people in person, but we can equitably bring people around the table from around the world. I think all of us are feeling very energized at the end of this week. I'm certainly feeling it. I hope you are too. And it's been a really great week of sharing and learning and advocating. For my closing, I wanted to just reflect a few of the words that came from the global hepatitis team. And because it's this team that are going to have to interact with all of you to take forward all of these calls for closing the treatment gap, closing the vaccination gap, closing the access to testing gap. So, and looking for something that's innovative for financing, that's always a challenge. And I think we have to take that mantle on very, very strong as we move forward. So a few comments were, passion for elimination, really conviviality and good humor. I think there was a dinner activity every night. So I think everybody got their fair share of wine and food in Geneva. I think we're surviving the post-pandemic recovery phase. We had at some point potentially up to 80 different participants, 14 different countries participating in some of our in-person activities. We learned about the 7 countries who did the pilots, and I think we have to take their lessons forward and see how quickly we can move on the path to elimination. And the regional sessions, if you tuned in yesterday, from our perspective, were really phenomenal. We heard excellent progress, and we have a few new countries who are on that path. Uzbekistan, China, Uganda, Argentina, we're making progress. I think all of us tuned into the SDG targets. We have to think about human rights, equity-based approaches, and serve the most vulnerable. So we keep that high. And it was nice to see some actual good examples of PHC integration. India and Thailand and Brazil will be leading the way. So we learn from that. I think we all came around to say we have to do something at the other end, cancer. These are the cancers are preventable through the vaccination, but also as people get more ill, we have to follow up and we have to ensure that treatments, care, palliative care, surgery, whatever it may be, need to be available. So what I was impressed was seeing the surgeons here, seeing the public health, seeing the advocates. And I want to end by saying, she's not here anymore, but there was a medical student. And it was so fantastic to see a medical student wanting to take on the Hepatitis Can't Wait, I guess, logo and mantra and share it with all of her fellow students. She spoke a lot about stigma and how we have to end that stigma. So in many ways, I see a real bright future in that medical student and all of you. So with that, hepatitis can't wait, but we will have a World Hepatitis Day on the 28th of July. So we hope that we can get you all tuned in to a virtual, some level of virtual event around World Hepatitis Day as it comes up. And thank you again. And I'm so excited to go to Portugal. So let's see, and if you can get Ronaldinho, I'll bring my son as well. Thank you. And with that, we're closed. So have a safe trip.